Hello and welcome to GastroVision. I'm Dr. Kazi Sohail from Government Medical College, Srinagar. In this session, we are focusing on one of the most critical aspects of liver anatomy, the hepatic veins and their relationship to the liver segments. From an EUS perspective, the hepatic veins are more than just as vascular landmarks. They act as natural boundaries that divides the liver into lobes and sectors. Mastering how to identify them is essential for segmental localization, staging of liver lesions, and planning liver resections. Before we analyze the EUS images, let's quickly review three main hepatic veins and their key roles. Middle hepatic vein. It runs along Catley's line, separating the left and right lobes of the liver. The right hepatic vein, it divides the right lobe into anterior and posterior sectors, and left hepatic vein, it divides the left lobe into medial and lateral sectors. These vascular planes are used surgically for hepatic resections and radiologically for segmental classification. Now, let's analyze the EUS image step by step. In this image, we identify middle hepatic vein which runs in the plane known as Cantley's line. This is a crucial anatomical landmark because it separates right and left lobes of the liver. It runs vertically from the inferior vena cava towards the gallbladder fossa on the inferior surface. The portal vein can be seen below an inferior vena cava posteriorly. A transverse line drawn along the upper border of the portal vein helps orient you to the lobar division. This view is the foundation for segmental localization. Next, in this image, we move deeper into segmental anatomy. Here, the middle hepatic vein again serves as a key reference line, but now we can appreciate the segmental divisions around it. Visible structures include segment 1, that's caudate lobe, that's adjacent to the inferior vena cava. Segments 4A and 4B forming the left medial sector. Segments 5 and 8 forming right anterior sector. A vertical line through the middle hepatic vein and a horizontal line along the portal vein together create a mental map that divides the liver into functional segments. This is particularly useful during segmental resections and targeted interventions. In this image, we now shift our attention to the right hepatic vein. The right hepatic vein is another critical vascular landmark because it separates right anterior sector, that is 5 and 8, from right posterior sector, that is segments 6 and 7. It typically courses from the posterior part of the right lobe towards the inferior vena cava. It provides an excellent orientation point for lesion localization and for differentiating sectoral anatomy during interventions. For example, a lesion anterior to right hepatic vein likely involves the segments of 5 or 8, while one posterior to it may involve segments 6 or 7. Finally, in this image, we see the left hepatic vein, which divides the left lobe into two main sectors. Left medial sector, that's segment 4A and 4B, and left lateral sector, that is segment 2 and 3. The left hepatic vein runs between these two sectors and is a crucial guide for segmental anatomy on the left side. Color Doppler here can help differentiate the hepatic vein from adjacent structures and confirm venous flow. Now let's summarize what we have learned about hepatic veins and their segmental significance. Middle hepatic vein, it lies along Cantley's line and separates the right and left lobes. Middle hepatic vein segmental view helps identify segments 1, 4A, 4B, 5 and 8. Right hepatic vein, it separates the right anterior and right posterior sectors. Left hepatic vein, it separates left medial and left lateral sectors. Together, these three veins form the vascular framework for segmental classification and their accurate identification on endoscopic ultrasound. It is essential for segmental mapping, staging, and therapeutic planning. Thank you for watching this tutorial on hepatic vein anatomy and segmental relationships from Station 1. This is one of the most vital topics in hepatobiliary endoscopic ultrasound, and mastering it will significantly improve your diagnostic accuracy and procedural planning. See you in the next session.